Meanwhile, there are now 45 million coronavirus cases recorded worldwide, and 46% of new infections are in Europe. Doctors in Belgium describe the situation there as a war zone. Patients have to share rooms, and medical workers are warning it's just a matter of days until the country runs out of ICU beds. ABC News foreign correspondent James Longman is in Brussels, joining us live now. James, I know you had a first-hand look inside one of the hospitals there. What was that like?
Diane, I've got to tell you, it was quite shocking. You know, me and the team, we've all been discussing in recent weeks just what the second wave might look like, whether lockdowns are really necessary, and to actually be in that ICU and just see the impact of this second wave was quite a thing. And for doctors to say to us, this is already worse than the first wave, just in terms of their capacity, their ability to deal with it, because cases have spiked so quickly in such a short period of time. And you heard there in Alex's report what's happening in the United States. Europe seems to be a couple of weeks ahead, and Belgium is a serious situation. The ICU we visited has tripled the number of COVID patients in the last 3 weeks, and doctors there are now forced to work knowing they are COVID positive. I spoke to a doctor there about how he feels about that. He said, well, we have no choice, because if we don't, the health system will go under, and that is why this country is considering putting the whole country into a national lockdown. There are emergency meetings taking place today. They've already come out with some pretty draconian measures, like kind of having these undercover health agents who are supposed to go from business to make sure that people are abiding by the rules, can issue $1,000 fines if they don't. But fundamentally, the great issue here is that they just can't keep up with the demand. And we met a man in an ICU, a 75-year-old man, Florent. It was his birthday, and the good news is that he was getting better in a way that he wouldn't have in March. I spoke to his doctor, and he said if this man had come in March, because we were ventilating very quickly, because we didn't have those steroids, his outcome would have been very different. Now he's getting better, but the fundamental point is that Florent still needed a bed, and that is the issue that countries across Europe are now grappling with, the demand for beds.
They need beds, and they need professionals to be able to work on them too. I know that's also in short supply. And James, Belgium is one of the worst areas, but I know the rest of Europe is also struggling to contain this. France is in another strict lockdown. Germany is shutting down restaurants and bars starting on Monday. How are people reacting to all of this?
Look, Diane, the economic and emotional consequences of further lockdowns are really taking their toll. We've seen protests break out in lots of different cities. Italy, particularly in southern Italy, we've seen a real pushback against this. People are really suffering. But fundamentally, European leaders know the spike is just too big. They're dealing with about 40 to 50,000 new cases a day in France, and that's why President Macron's decided to institute this new lockdown. We saw some extraordinary pictures of thousands of people from Paris trying to frantically get out of the city. You saw basically every street, every road in Paris gridlocked as people try to get out. Now, a lot of people were criticizing that, saying they were spreading the virus around the country. But actually, there's a suggestion that this is part of a French strategy to kind of make sure that the risk is spread, because no country is going to be able to get rid of COVID soon. But what they can do is spread the risk, and it might be that that was what was going on in Paris. But I have to say, fundamentally, there's a big issue across Europe, which is there's been a lot of testing. There hasn't been enough tracing. And we've been in the last week to Lyon, to Paris, to Italy, to Brussels. I live in London. In every country, they're dealing with two great issues. A lack of clear messaging. A lot of people are kind of not understanding what it is the government wants them to do. They're being tested, but once the government and the health services in these countries have this information, they're not really doing anything with it. There is no tracing. So whilst cases are going up, we can't follow them where they go. We don't know where people are going. We're not sure where these kind of these infections are spreading in the wider community. And I think that's the great issue that Europe is dealing with. When we had our first lockdowns across this continent, the hope was during that time that governments would fix their test and trace systems. They didn't do that. And so now lockdowns look to be an inevitability for countries across Europe. Diane?
Still struggling to manage this so many months later. James Longman in Brussels. Thanks, James.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.